Thank you, Dr. Indamoon. Good morning, everyone. First of all, I would like to say thank you to APAO and AIOS for providing me this opportunity to speak from this prestigious podium. The topic of presentation is blindness and the role of NGOs. We would like to discuss the impact, the strategies and the challenges faced by NGOs. Blindness and role of NGOs in India is great. Blindness is a major public health issue in India. NGOs play a crucial role in the prevention, treatment and rehabilitation. Collaboration of NGOs with government, private sector and international organization enhances their impact. Vision, the most dominant of our senses, play a critical role on every facet and stage of our lives. We take vision for granted, but without vision we struggle to learn, to walk, to need, and to participate in school and to work. Visual impairment has serious consequences for the individual across the life course. Many of these consequences can be mitigated by timely access to quality eye care. Eye conditions that cause visual impairment and blindness, such as cataract or refractive errors, are the main focus for eye care strategies. Vision loss can affect people of all ages, however, more than 50 years are more prone. National Blindness and Visual Impairment Survey conducted in 2015 and 19 in India show that 4.95 million people are blind and more than 8 million people suffer from severe visual impairment. This pie diagram shows that cataract and refractive errors are the major chunk of causes. A high proportion of blindness and visual impairment are due to avoidable causes. And what is blindness? Visual acuity less than 360 in better eye with best correction is blindness, and visual acuity less than 612 in better eye with best correction is visual impairment. So, blindness is of two types, non-avoidable and avoidable. Some of the causes of non-avoidable blindness are certain genetic conditions like retinitis pigmentosa, advanced AMT, glaucoma, severe brain and eye injuries, tumors, etc. Whereas the major causes of avoidable blindness are cataract, glaucoma, refractive errors. Now, NGOs have a great role in eye care. They arrange awareness campaigns. They are responsible for preventive care, surgical interventions they take care of, and visual rehab and advocacy and policy support is their mainstay. Now, there are few challenges which are faced by NGOs. The challenges are in the form of funding constraints. Regular meetings with funding agencies play an important role, although funds are always wanted and welcomed. Reach and accessibility. Outreach programs sometimes face challenges due to weather, distance, geographical constraint, but God helps us, fortune favors the brave. Awareness and superstition. Awareness is created by trained staff through speeches, and superstitions such as rainy season is not in rainy season cataract surgery should not be done. This is a myth which is to be addressed. Then the surgery is the only answer to cataract, we tell the patients, and glasses will improve the quality of life with patients with refractive error. Skilled workforce shortage. It is not an issue in our college, because in our hospital, because of the availability of paramedical college and college of nursing, but certainly for other NGOs it is. So government and NGO collaboration is very important. NPCB aims to reduce avoidable blindness to 0.25% by 2025, and the chief of DBCS, that is Chief Medical Officer, really collaborates well with us. Ayushman Bharat, launched by launched by Government of India, is a blessing to all the needy. Training programs play an important part. Future strategies for NGO. Expanding telemedicine and mobile eye care units and embracing digital transformation is very important. Strengthening corporate CSR partnership is very important. Increasing community participation and adapting to societal needs is also very important. I am working with a charitable church-based institution, Philadelphia, popularly known as Mission Hospital at Ambala. It is also an NGO and performs many school health surveys. Annually, nearly 50 screening camps for various eye diseases are done in far-flung areas with the help of some NGOs. We perform nearly 2,500 cataract surgeries annually. Other surgeries like squint erigum also are done. Awareness camps by optometrists are done by teaching the villagers. Distribution of glasses to treat refractive error is also done. IOP measuring and fundoscopy for early detection of glaucoma is also done. Surgical intervention at base hospital, providing free transportation and meals, is also a blessing to the society. Visual rehab is also done in post-op cares by giving glasses. Advocacy and policy support is done in the form of monthly meeting with sarpanches, religious heads, etc., to discuss the means of publicity, accessibility of patients, execution of camp at ground level. Now I would like to show you some pictures showing community ophthalmology work done by our hospital. This is Ghazi Khan, single-eyed patient, was operated by our hospital in Anantnag in 2007. He lost one of his eyes in beer mauling, and the another eye was operated by our hospital. Before surgery, life was not good for him, but after surgery, he said he could see his food in the plate, he could go to the washroom, he could clip his nails and mustaches. It was a life turned 360-degree good for him. Second picture shows bilaterally blind couple suffering from hypermature cataract. They were very anxious before they came, but they were holding hands in hands, still they are. And so on day 1, either eye was done, and on the day 2, the next eye was done. And when it was done, they were very happy. So this is an old picture when SICS was done. Now we are doing phacosurgery in all cases. These are few pictures which show all the activities done in camp, that is taking vision, doing fundoscopy, then optometrist doing OPD, lab technician ruling out diabetes by doing blood sugar. I would also like to address few key NGOs working in blindness prevention: Sankara Eye Foundation, Arvind Eye Care, Mission for Vision, LV Prasad Eye Institute. These institutes are doing really good. So in conclusion, I would like to say that NGOs have significantly reduced blindness rates in India, but more investment, awareness and collaboration are needed. With sustained efforts, preventable blindness can be eradicated. All we need is teamwork. Together, everyone achieves more. Last but not the least, true perfection is a bold quest to seek. Only the willing and true to heart will seek the betterment of many. Socrates. Thank you for a patient listening. Thank you.